Hi, my name is Chris, and today we are going to be working on a sequence to release the hips and the lower back. A lot of times you might see a client coming in complaining of lower back pain, and what we're going to do is we're going to address the hips because in most cases the lower back pain originates in the hips. For the sake of keeping the video nice and short, we're just going to work on one side of the body today, but you always want to make sure that you're working both the left and the right side so we can get a release on both the left and the right side of the patient. So we're going to start by having the client lie on her back in prone position, arms down by her sides, and we want the feet wide enough that they can rest to the outside of my knees when I'm sitting comfortably on my knees. I want my knees to line up right about at her ankles, and we're going to start by just pressing the feet open. And all I'm doing is stacking my joints and rocking side to side using my body weight to press the feet towards the ground. Then we're going to start to palm walk up the legs. And again, I'm just placing my hands on the inside of the calf, stacking the joints and just using my body weight, rocking side to side. Once we get to the knee joint, we're going to hop over the knee joint, come into the quads. I'm coming up onto my knees and same thing, stack the joints, rock side to side. Once we get to the top, we're going to hold. And then when we release, we're walking back down the legs, just retracing our steps. We get to the knee joints, we're going to hop over the knees. We never want to put pressure on the joint itself. And we're just palm walking back down the calves. Now from here, we're going to grab a hold of left leg. I'm going to lift it up. And from here, I'm going to take my left hand and cup the Achilles tendon. My other hand is going to be placed on the top of her foot, and I'm just going to lean back to create a little bit of traction in the hip and knee joint. I'll do this 3 times. Each time I'm going to walk my hand up the foot just a little bit more. And that's 3. And after the 3rd time, I'm going to rotate to the side, and I'm going to come onto the outside. Now I'm going to take my right hand, I'm going to place it right below her hip bone, and my left hand is going to internally rotate her left foot. And then just like we did before, we're going to palm walk up and down the leg. Except this time we're going to start with both hands on the outside, working our way towards the center. And we're just stacking the joints, rocking the weight side to side, using our body weight. We get to the knee joint, and then we walk all the way back to where we came from. And then again, placing our palm right below the hip bone, internally rotating that left foot. I'm going to go ahead and release. And I'm going to shift my weight all the way up so that I line up with her hip bone. Now I'm going to find the hip bone, and I'm going to go just below that. We're going to stack our hands, and we're going to find right here where the piriformis is exposed. All right, you're going to feel it. It's going to feel like a little wire. And we're just going to draw circles with the tips of our fingers. This one can get very intense, so you don't need a whole lot of pressure here. I'm going to do about 5 circles in one direction, and then I'm going to go 5 circles in the other direction. And I'm going to adjust, coming back to line up with the knee joint, and we're going to palm walk the outside line of the leg one more time. Once we get to the knee joint, I'm going to bring my hands together, and with stacked thumbs, I'm just putting a little bit of pressure on the outside of the shin bone. Now from here, I'm going to take my right hand, I'm going to place it to the crease of her left knee. I'm going to bend as the left foot comes right to center, flaring the knee out to the side. And I'm going to adjust myself, coming back down towards her feet. Now from here, I'm going to take my right foot, I'm going to step it up right to the outside of her left hip, and I'm palm walking on both thighs. We get to the knees, and we go back to the center. About 2 or 3 passes should be enough, depending on how much time you have. And now from here, I'm going to make a small adjustment so that I'm coming in line with the bent knee. And I'm going to bring my hands together. I'm just going to do butterfly presses, stacking my joints, leaning my weight forward. And we're just walking up the thigh. And back towards the knee. And then one more pass all the way up to the hip. All the way back to the knee. Now from here, I'm going to drop my hips down and have a seat. I'm going to swing both legs around. My left leg comes to the outside, my right leg comes to the inside. Using my right leg, I'm going to press to open up this hip. And I'm going to take my right foot and tuck it to the inside of her knee crease. And I'm going to take her foot and wrap it around my leg, coming into this leg lock position. Now my left leg is going to come over, and I'm using the outside edge of my left foot to just start to press into the hamstring. I can use my left leg, my left hand rather, to hold onto her foot, to keep her where I want her. And we're just pressing, walking up the leg. And again, about 2 or 3 passes should be enough. And now from here, I'm going to tuck my left foot under. I'm going to grab onto her leg, lift it up, and I'm going to come all the way up onto my knee. I'm going to take my right foot and place it to the outside of her left hip, and I'm going to take her left foot and place it right in the crease of my hip. I can use my right hand to kind of keep the knee in place, and we're just going to lean our weight forward, pressing her left knee towards the ground. I'm going to take my left hand and I'm going to place it on her right thigh. And as I press the hip open, I'm going to palm walk with the left hand. And then as I finish, I'm going to rock my weight back, making sure that I support the knee the whole way down. I'm just going to gently lower this leg all the way back down to the ground. And from here, I'm just going to do a few presses, opening and closing the hips by pressing the ankles down towards the ground. And normally I would repeat that same sequence up the other side of the body, but for the sake of time, we're going to go right into sideline position. So what I'm going to do here is I'm going to take her right leg, make a small adjustment, bend the left knee, cross the foot over, and we're going to instruct the client to roll onto her right side. From here, we're going to lift the leg, and I'm going to slide my knees under and just come to a kneeling position, allowing the leg to rest on top of my thighs. First, I'm going to start by taking my forearm and just doing some presses into the IT band. This is another area that can be very sensitive, so we don't need a whole lot of pressure. We're going to walk down towards the knee and then back up towards the hip. And just like before, 2 or 3 passes and that should be good. And from here, we're going to work into the piriformis. So you might have to search around for the piriformis because everybody's is in a little bit different position. But what I'm going to do is I'm going to take a stacked thumb and I'm going to start to press into the glute until we find the spot that is the most tender. Sometimes you can gauge it by their reaction, or you can just say, let me know when I hit it. Is it right there? Mm-hmm. There it is. So once we find it, I'm going to take the tip of my elbow, put a little bit of pressure, and then we're going to cup the bottom of the leg like I'm holding a football, and we just want to start to internally rotate the hip. Internal, and then release external. We're keeping constant pressure in the right elbow. Again, not too much because this can be a very sensitive area for some people. So right now what we're doing is we're internally rotating the hip as we place pressure with the elbow. So next we need to go into an external rotation. So I'm going to let go of this leg. I'm going to take my left leg and slide it back to get it out of the way, and I'm going to drop her foot down to the ground. And I like to take my foot and place it here. Like a little wedge so that her foot doesn't go anywhere. Now I'm going to take my hand and I'm going to cup the inside of her knee, and I'm just going to pull towards me, coming into an external rotation. Still putting constant pressure into the piriformis with my right elbow. And now we're going to release. I'm going to lower this down by sliding my knee out. And then I'm going to hop to the other side. Last thing we're going to do to finish this off is come into a spinal twist. So I'm going to grab onto her left arm. I'm going to pull her into a spinal twist position. I'm just going to pull and let this arm fall down to the side. Now from here, I'm going to take my right hand and I'm going to place it right on the top of her shoulder. My left hand is going to go right to the top of the hip, and what I want to think about doing is pressing the shoulder and the hip away from each other. Okay, so I'm going to instruct the client to take a deep inhale, and then exhale, and as she exhales, I'm going to press. And I'm going to have her resist, like she's trying to come out of the twist. So go ahead and press your shoulder into my hand. We hold for just a few seconds, and then go ahead and let it go. We press a little bit deeper. We're going to do this 3 times. Inhale, exhale, release. Go ahead and resist. And release. One more time, inhale. Exhale, release. And resist. And go ahead and let it go. Very nice. Now we're going to go ahead and grab onto this leg and we're going to bring it back to center. Lower it down. And back to the front. We'll make our little adjustments. We're back on line. And shake out those hips. So from here we would go into the other side and do the whole other side of the body to make sure that she's nice and even. And that's it for the hip and lower back release. Thank you. Namaste.